Good morning. One, two, three, four, 5, 6, 7, 8, 9, 10. Good morning. As we start off every morning on Fridays, where we do our data roundup and cover a wide range of topics, I have with me today our County Executive Armin Budish, who's been a stalwart supporter from the beginning of this, and we're very appreciative of that. Dr. Heidi Gullett, my partner throughout, thick and thin, and of course our one of our co-directors of Prevention and Wellness, Ramona Brazil, who'll be here to wrap us up. So that's how we'll round out the morning for you. And with that, I'd like to hand the podium over to Executive Budish.
Good morning. Thanks as always to Terry Allen and Dr. Heidi Gullett and the entire team here at the Board of Health. This situation, this crisis continues to evolve, and the work that this Board of Health does is just outstanding. It's consistently outstanding, and it's crucial, especially as now we're beginning to reopen businesses in the county in a limited way, but it's still very, very important. So knowing that they're on top of it and monitoring the situation is very comforting for me and for all of us here. Speaking of the good work of the Board of Health, I also want to mention that there's a special person here at the Cuyahoga County Board of Health that really represents the giving spirit of our community, which we've seen over and over again in this crisis. Amy Anter is a public health nurse. She's an investigator and an expert contact tracer. She retired from the Board of Health last month after 30 years of service. Because of her dedication and her commitment to public health, she saw what's going on, and she asked the Board of Health if she could stay on as a volunteer, even though she was retiring. And she's been working for the last month as a volunteer, doing very important work in that capacity. Her continued work is an important part of our community response to this crisis, and a really good example of the giving spirit that certainly the employees here at the Board of Health share, and we see throughout our community. So I want to thank Amy Anter for all her great work. I also want to take a moment to thank the voters of Cuyahoga County who voted overwhelmingly this past week in support of the Health and Human Services levy. The levy passed 70-30, which is a resounding testament to the generosity and compassion of our community. With these dollars, the county will be able to continue the critical services that we provide for foster children, for seniors, and for other vulnerable populations. For these vulnerable populations, life's only gotten harder during this crisis. I know that people who never thought they'd need help are reaching out for help now. The Health and Human Service levy will give us the resources to help meet these needs. Many people in our community are out of work due to the coronavirus, and small businesses are closed all over the county. And while there will be a limited opening in the coming weeks, many businesses will still remain closed under the governor's orders. While it's necessary to protect our health, the steps that the governor's taken have been designed to protect our health, and I support them. This is causing unprecedented economic devastation. I announced here just a couple weeks ago that the county had worked with local partners, including Key Bank, ECDI, Jumpstart, the Urban League, NDC, Village Capital, the Greater Cleveland Partnership, and the President's Council to create a small business stabilization fund to help support small businesses. That was announced at 9 a.m. On that Friday, right here, and by 5 that evening, we had already received 975 applications. By the end of the first round, which closed the following Thursday, 1 week later, we had 3,100 applications, with 50% being eligible to receive a grant based on our criteria. My thanks to a number of people, ECDI Cleveland Director Danielle Sidnor, who partnered with the county economic development team. Ted Carter's here someplace, our economic development director. They made this happen, and Danielle served as chair of the grants committee. The committee also included Erica Pennick with the President's Council, Corey Leon and David Lucas from the National Development Council, Michael Elliott with Cleveland Neighborhood Progress, Gina Cheverine with the Greater Cleveland Partnership Business Growth Collaborative, Shakira Johnson with Key Bank, Regina Johnson with our county staff, Bradford Davey with the Fund for Our Economic Future, Lauren Novick, Jumpstart, and Shoshana Duckworth with the Urban League. I go through that list to show you that this was truly a public-private partnership in the best sense of the word, and they were working hard in a time of crisis. ECDI will release the names of the grant awardees next week, as each recipient is now being notified that they are a recipient. There's just some paperwork that they still have to provide, and then they'll be able to receive their grant. We hope to get the funds out. We expect we will get the funds out next week. Those who are not eligible for a grant are being encouraged to apply for one of the loans being offered by the same stabilization fund. That fund has a total of about $4 million in funds for the loans. Obviously, the need is very, very great. So we'll be announcing a second round next week. I should be able to launch the fund, the second round of the fund, right here at next week's briefing. Residents and businesses are not the only ones that are severely impacted by this crisis. Local governments that rely on sales and income taxes and a whole bunch of other taxes are also being hit hard. With so many businesses closed, counties and cities across the state of Ohio are projecting about a 20% loss in revenue. Cuyahoga County is no exception. Through our projections, we believe are conservative. We anticipate a $76 million loss in revenues for the county government. We received $215 million from the Federal CARES Act, but that money is very, very limited in how it can be used. It can only be used to pay COVID-related expenses, but cannot be used to support our budget or pay for budgeted expenses. We've been actively and aggressively lobbying our federal elected officials to enact legislation that would give us more flexibility with respect to the CARES Act money, with respect to how we can spend it. But so far, we've not been successful in that effort. We hope that things will change, and we're going to keep on trying to get it changed. But right now, we cannot use those funds to offset revenue losses in our budget. That's why I've had to make some very, very difficult decisions. We must be good and responsible stewards of the taxpayers' dollars. So I've had our employees take 2-week furloughs. I've instructed that there be a hiring freeze at the county, and I'm asking our departments to propose 15% budget cuts. Some people have urged us to wait before taking these budgeting measures. They say that the federal government may give us more dollars that we can use to support our revenue losses in the budget. And I understand that position. It may happen. I hope it happens. And we're still working to make that happen. But it would be irresponsible to wait to start our money-saving moves. The cuts we're making are hard. They're very difficult. And they're painful. But I can tell you that for every month that we wait, if the federal government does not give us more money or more flexibility, it'll just get harder and harder to fill our growing budget hole. I want to assure you that we'll continue to provide necessary services to those most in need, as we have always done. We will manage this crisis, and we'll do it carefully and wisely. Thank you.
Thank you, Executive Budish, for your leadership and your support throughout this very difficult time. We know a lot of people are hurting. We know a lot of disruption has occurred at many levels. And at the same time, we know that we've saved a lot of lives. So that is the central challenge that we face now and going forward, what we faced from the beginning of this. And so that is still before us, and as a community, we have to handle it together. I have a new mask today I want to show you. This is from my wife. Her mother was from Glasgow, and so of course plaid is appropriate. And today is my wife's birthday. She didn't know I was going to do this, and she'd probably rather I didn't. But my best friend and the love of my life, who hasn't seen much of me in the last few months, happy birthday, and thank you for everything. So first off today, I'd like to recognize the great work being done by the staff at the County Donation Center. The Donation Center is a place where medical supplies and personal protective equipment are received, staged, and stored, and distributed in preparation for a response to a public health event or incident. In response to the pandemic, the County Donation Center has been operational since March 26th. In order for the Donation Center to become and remain active, a number of organizations had to come together. And we're grateful for the ongoing partnerships that the County Executive Budish has arranged that help to support this critical work. Among the partners are the Cuyahoga County Public Works Department, which provided the facility and the storage space, the equipment to move around the inventory, and making staff available to offload supplies from semi-trucks. We appreciate the support of the director, Michael Dever, and his staff, who've been so on the spot for us in handling the supply and protective equipment inventory at the Donation Center. Their commitment has been critical to keeping our frontline workers safe. And the work we've done around contact tracing, around quarantine and isolation, and response in this community, together with the telehealth lines, has really flattened the curve and really created a plateau that has helped to buy us time to save lives and conserve personal protective equipment and conserve and have available critical equipment like ventilators to protect people and help people should they have to seek care. The County Sheriff's Office has been critical for security, and we appreciate Sheriff Schilling and his deputies that have been there for us throughout. And we also have gotten assistance from the State Highway Patrol, so we appreciate Governor DeWine's support in that regard. I wanted to say that the leadership that Governor DeWine has shown and Dr. Acton, his state health director, has shown has been a model for all of us. They've been a beacon of light at the local level for how to do business in very difficult times. And that means that tough decisions have to be made. Tough decisions that also may result in the kind of economic challenges that we've seen. But we believe the data has pointed the way throughout the process, and the data needs to continue to point the way on how to move Ohio through the process, Cuyahoga County through the process, to protect as many people as we can. There have been devastating losses so far, and Dr. Galt will talk about those numbers and the names and faces of people that are in those numbers are important for all of us to remember. And that's what we're doing now. We're making difficult decisions to save lives, and we'll continue to do that. So I also want to lastly thank, in this inventory management, our staff who have worked anywhere and everywhere in this response at the drop site, working with inventory, helping to deliver critical supplies for people that are quarantined or isolated, answering the phones in a phone bank where many, many thousands of calls have come in, working in the back office to assure that our operations continue to run, and all the work around contact tracing and isolation and communications. We appreciate all that they do. And Kevin has been, of course, here critically to help us work through these communications and press conferences. So anyone who works with the public or in the preparedness fields knows that you can't pass out business cards during an event. You have to know people in advance. So we've done lots of drills and tabletop exercises over my 30 years here. And those drills are critical to identify gaps and create opportunities for improvement. And I think it's showing during this pandemic that the partners are working together hand in hand, as they always have, at the Emergency Operations Center, at the health departments, and together working with a whole range of supporting folks in the medical community. So we rely on the availability of these critical medical supplies in the presence of a reliable storage and distribution network in order for all this to be successful. So you can make a donation to the donation center, the drop site, which is at the Cuyahoga County Public Works Garage at 2501 Harvard Avenue in Newburgh Heights. Gowns, eye protection, face shields, nitrile gloves, disinfecting wipes, and hand sanitizer are all critical supplies that the community needs as we begin to very safely and very slowly, in a phased approach, work toward opening different parts of our society. Unopened boxes of these items will be accepted Monday through Friday from 9:30 to 2:30 p.m. Let's talk a bit about graduations. That's been on the mind of a lot of folks. We know this has been hard. There are seniors at colleges and high schools. There are a lot of workers in those institutions that have been affected, adversely affected, and lots of disruptions and lots of pain, as Executive Buse has said, in this process. And we know that graduation is on the minds of everyone. And now people are looking at ways to do this safely and differently in this new normal that we have. So as planning takes place for the close of the current school year, we know that graduation certainly is front and center. You've heard the governor talk about it, and we've received guidance from both the state health department and the State Department of Education, which has been very helpful as we work with school districts as they look to innovate in this process on how they approach graduation. And these are careful steps, thoughtful steps on what we think is the most protective way to do the things that people need to do, and that will be central to the work forward. So we have to remember that we're still enforcing state orders, stay at home, to properly social distance, and to keep gatherings at 10 people as a maximum. Under the stay-at-home order, which has been extended, and the intent, of course, is for people to go out when they need to conduct essential personal business only. Making smart public health choices, as Ohioans have to date, as Greater Clevelanders have to date, and limit interaction with large groups of people makes good sense. This approach has clearly worked. This approach has worked. That means going to work, the grocery store, the bank, taking a walk. All these things need to be done in a protective way to reduce the opportunity for people in groups to gather and cause spikes in community transmission. We cannot stop the virus from circulating in this period now. We know it's in the community. We have to reduce the potential for starting new chains of transmission in places. We don't decide the timeline, as Dr. Fauci says. The virus decides the timeline. As a state, I think we've done a great job at flattening the curve, and in this plateau we maintain those responsibilities to continue to protect the community. We've done this in large part by staying at home, by proper socially distancing. And when we talk about that, we say physical distance, social connectedness with the people that we love. And so these are keys. In order to protect the health and safety of those involved and to also properly abide by the state orders, we've been working with school systems in our jurisdiction around creative ways to hold graduations that also protect our loved ones. Those approaches may include drive-through events or virtual ceremonies, which limit gatherings of small groups. The evidence is clear that this reduces risk for community spread of COVID. I wish that we didn't have to make these types of decisions. However, right now, we're all making sacrifices that are difficult to accept, but are central to the safety and health of our community. Sadly, there will be more decisions like this that have to be made as we move through the year. The data has guided us throughout this pandemic, and it will continue to guide our decisions going forward. This is about saving lives and protecting people, and we all share in that sacred responsibility. As a health commissioner, I can't recommend easing restrictions and placing countless people at risk. I appreciate your understanding and continued support for these very difficult times. We're all doing the right things. So returning to work, there's been new guidance, certainly that everyone has seen from the state. As people return to work, the Ohio Department of Health has issued this guidance for employers and employees. We encourage you to visit coronavirus.ohio.gov to find more information under the Responsible Restart Ohio tab. You can also find a link to information on our website at ccbh.net. One of the common themes you'll find is wearing a mask, like this mask, to protect others. I would like to offer this reminder that if you don't yet have a mask, there are many instructional videos online about making one for yourself. Whether you use a scarf, a bandana, or a t-shirt, as Dr. Adams, our Surgeon General, has done, there are several options. Given that wearing masks in public will be the standard, it's important to be prepared. The data from the CDC demonstrates that wearing masks works. If I wear a mask, I protect you from me. If you wear a mask, we protect each other. We must all do our part to protect our family, friends, neighbors, co-workers, and even people that we've never met. These people are part of our community, and these public health strategies have clearly served us well. So with that, I'd like to transition to our esteemed medical director, Dr. Heidi Gullett.
Good morning. We have only one sign language interpreter this morning, so we're going to take a brief break and let Heather rest for a moment so that she can move on with my remarks, which tend to get a little technical on Fridays around data. All right, so we have returned. Thank you, Heather, for bearing with us on what tends to be long Fridays, press conferences. So before I start with reviewing this week's data, I would like to again start with gratitude. Gratitude is one of the principles that's really helping all of us here at the Board of Health get through this difficult time. And so I'd like to start this morning by thanking all of the individuals in our community who are serving those who are homeless. There are quite a few people in our community who work day in and day out, month after month and year after year, serving the homeless. And they are amazing servants. I look up to them all the time, but particularly in this difficult time. And so it begins with the support from our county administration and all of the people in county government working really hard to make sure that people have a safe place during this time. That's a wide coalition of people. And then there are a lot of people in nonprofits also working on this, from shelter staff, such as 2100 and Salvation Army Harbor Light, to Northeast Ohio Coalition for the Homeless, to many Metro Health doctors and nurses and other staff who are actually out in the field checking on those who are unsheltered and making sure that they are safe and getting them sheltered when they are found to have symptoms or other issues going on. So I'm sure I haven't captured nearly the number of people or groups involved, but I've had a new window during this response into those who serve the most vulnerable on so many levels in our community. And from all of us at the Board of Health, we just say thank you for all you do before the pandemic, during the pandemic, and all the things we know you'll do after. You're an inspiration to all of us. I would also like to just take a moment and thank our medical students who I have talked about from time to time. We have an army of medical students from Case Western Reserve University School of Medicine who have intermittently come here for rotations over time. They're here on an agreement that we have with the School of Medicine. But they have really stepped up in the past 5 to 6 weeks in providing invaluable support for our COVID-19 response. And this ranges from first to fourth year medical students. And we have senior medical student, Andrea Zabo, who has been here with us every day for the last 5 to 6 weeks and has recorded videos you see on our website, has talked to medical students across the country who have called in to ask about how they can do this in their own communities. And then we have fourth year medical students who have devoted a ton of their final weeks of medical school to working with us here. And you're going to see some information about the number of cases that we have cleared this week. And it's remarkable. And that is in large part due to Andrea and our third and fourth year medical students. And for our fourth year medical students, this has been a very difficult year, as it has for all of us. But the rites of passage that you have as a graduating medical student are getting your match day when you find out where you're going to do your residency, and getting to walk across the stage and be hooded, meaning you get to get your medical degree with all of the pomp and circumstance we're all used to, as many others graduating at different levels in our community will miss out on that in-person experience. But I wanted to send a special thank you to them today because I have the privilege of getting to see them on day one when they get their white coats, and the privilege of seeing them on the last day when we launch them in to residency as doctors. And I know how hard this has been for you all, and I thank you, and I thank you for spending time you could have spent elsewhere with us, making sure our community has what they need. So thank you from the bottom of my heart as one of your faculty members. We'll take a moment and allow the cameras to pivot. If you could just wait until Heather finishes signing, and then we'll start the data. Good. Thumbs up, everybody? Okay. I wish everyone at home could see the amazing work of our media partners fully socially distancing with a lot of camera equipment. It's very wonderful to see. So again, thank you all for helping to cover this story day in and day out. So for Cuyahoga County Board of Health jurisdiction, our lab confirmed cases this morning are 1,237. Our probable cases are 441. Our total cases are 1,678. And our age range remains 1 week of age to 101 years of age. The breakdown for sex is 54% female and 46% male. The date of illness onset for our community is February 28th to April 28th. So you see that we continue to see new infections and people becoming symptomatic within the last few days. I'm very pleased to report our recovered cases at 507, in large part due to our medical student team who has really focused on this week and reached out to some of our people who were diagnosed very early and found them to be doing very well. The number of identified contacts is 3,256. And remember that these individuals then are given information and an order of quarantine because they're at risk for the infection. So this is the essence of contact tracing. And some people who used to be in that contact number became symptomatic and have moved into the probable cases, the numbers that I gave you earlier, or the lab confirmed cases if they were able to be tested and found to be positive. Again, every time I share information about fatalities or deaths in our community, I just ask viewers to remember these families and these individuals. We're at 86 deaths in our jurisdiction, with 85 of those being lab confirmed, and one a probable case who had a confirmed contact with a lab confirmed case. The age range of these individuals is 53 to 97 years of age, and the median age of those who've lost their life in our community to COVID-19 is 78. Dates of death range from March 20th to April 30th, and breakdown of 48% female and 52% male. Total cases, we have hospitalizations at 18%. So again, 18% of cases have been hospitalized. We do find out additional information about people who were hospitalized in the middle of their illness course once we discontinue them from isolation and do that discontinuation interview. So if they aren't hospitalized at the beginning, we often don't know until the very end. So this number continues to change as we clear more people. Admissions to the intensive care unit, given the current roughly 1,600 cases, is 6%. And as I usually present healthcare workers, 23% of our cases identify as healthcare workers. Again, broadly defined, those are anyone who works in the healthcare industry. 22% of cases, we don't have this information, either yes or no. So we continue to try to obtain that, and often we're getting that on the back end when we talk to someone at discontinuation of isolation. So we hope to continue to reduce the unknown status as we move along. Pre-existing conditions are those medical problems that would affect someone's ability to fight off this infection. And those are at 43% of our cases, but 34% of our cases, we don't know that. So we have a lot more information for those who are hospitalized, and the newer cases that we have, sometimes it's harder for us to get that information, but we continue to also collect that again at the discontinuation interview if we haven't previously gotten that information. This just shows you the exact same thing I presented in graphical form. We know people like to see things in different views, so we're trying to provide additional graphics. You see the percent of healthcare workers unknown, the percent of pre-existing condition, and those unknown. For total cases, the racial and ethnic breakdown is as follows. 0.8% of our cases identify as Asian, nearly 33% is Black, 55% is white, 3% as other, and 8.5% as unknown. And as I've committed to other weeks, our team is very dedicated to getting this information and continuing to reduce the amount of unknown data that we have. For ethnicity, 76% of people in our case pool identify as non-Hispanic, and 2.4% identify as Hispanic, Latino, or Latina. 21% are unknown. This continues to be a challenge for us to get this information, but we continue to do our best as a team to ask people how they self-identify. This graphic is analogous to one I gave you last Friday with new updated numbers, and this includes lab-confirmed cases and probable cases. Again, the numbers I give you at the beginning are always higher because we have to pull these data a few days earlier to do analyses. So you see here the race data for the combined lab-confirmed and probable cases at the top. You also see ethnicity data below. You see data on male and female to the bottom left, and age group data over to the bottom right. Again, this week on age group data, you see the vast majority of cases for frequency, meaning the number of cases, in the 50 to 69 age range. We still have had cases under the age of 19, so those are pediatric cases. 4% of our cases are in that age range, and 11% of our cases are people 80 and older. And as you've seen from other data, we have quite a few people in our community in their 80s, 90s, and 100s who have been affected by COVID-19. I wanted to give you additional data that our team has prepared on race breakdown for hospitalized patients and ICU admissions. This is important as we consider the disproportionate effect of this infection on certain parts of our population. You see hospitalized patients, 57% male, 43% female. And just to be clear, we also ask about gender identification, so should that be something that's identified, we will also present that. Race, for hospitalized patients, Asian 1%, people identifying as Black nearly 38%, white 53%, other almost 4%, and unknown 5%. And for ICU admissions, you'll see that we have 64% male, 36% female, and this actually is pretty consistent with national trends, where we see a little bit higher males with more serious complications. That's an association, not a causation, but it's something that has been reported in other areas. And race, identifying as Asian 1%, Black 45%, white 46%, other 5%, and unknown 2%. And you'll see that again this week, those who are hospitalized and those who have ICU admissions and identify as Black have a higher percent as compared to the general percent of cases of individuals who identify as Black for their race. This is the same curve I've been showing you for weeks, which I know you all love. So we will move on. This is our epi curve for the week. This is updated from last week, includes the same information that we've previously shared plus this week's information. The blue lines, which continue to go up, are those who have been discontinued from isolation or cleared from infection. And that is the work of those students I thanked at the beginning. Several of us have done some of those clearances, but they've done the vast majority. And you'll see this week they've really been doing quite a few. So they're actually proactively reaching out to people from early infection. So you see that we continue to have great joy in seeing people moving past this infection in our community, but we still continue to have new infections. And they're very similar in the frequency of new infections as compared to last week. And we continue, as you saw earlier, to have deaths related to COVID-19, which always lag behind new infections for a few days to a few weeks. This map represents combined cases from the City of Cleveland jurisdiction, as well as Cuyahoga County Board of Health. These data represent both lab-confirmed and probable cases. And as we have mentioned previously, the map continues to become darker, meaning the frequency of infections continues to rise nearly everywhere in our county. This also represents where people live, not where they contracted the infection. Just a reminder that that is what this represents. Finally, I will close with talking about the hospital utilization. This means that the percent of what is available for each of these resources and how much of that we are currently using. And I like to give you the percent as compared to last week. These are just 4 pieces of a lot of other things we monitor around hospital capacity. This is also, again, not for any one system, but for all of our hospital systems combined across Cuyahoga County. And we know, given our amazing hospital resources here, that we also care for people who live outside of the county, who seek high levels of medical care here, who are quite sick and may need transferred in from other hospitals. So we are at a medical surgical adult capacity. We're about 70% of that capacity, which is very similar to last week, just an increase of 2%. For pediatric medical and surgical beds, we have decreased 1%. We're at about 42% of the available beds are being used. Adult critical care beds, we're at 68% of those beds being used currently. That's an increase of 5% from last week. And with regard to ventilators, we're at 29% of the available ventilators in our community, and that's an increase of 1%. We do have a healthcare reopening today, and ambulatory, meaning outpatient surgeries, where people do not have to spend the night, are opening. We also know that people are still having emergency surgeries and being cared for emergencies unrelated to COVID on top of COVID-19 infections. So these numbers represent people being cared for all of these issues, and we'll continue to closely monitor them as our healthcare system opens up slowly and very intentionally. So before you pivot the cameras, if you could just wait for Heather to finish signing, we will take another brief break to allow her to catch her breath and also reposition over to the podium for Ramona's remarks.
Good morning. I just have a few remarks today. First, I also wanted to start with a couple of acknowledgments. First, I just want to say congratulations to our former Director of Prevention and Wellness, Claire Butler, who retired last week after 35 years of nursing service, both here in the hospital and 20 years at the Board of Health. So I teased her that I first started working under her during the H1N1 pandemic, and now she's leaving during the COVID pandemic. So she kind of bookended our relationship with pandemics, so very interesting. I also want to say congratulations to Amy Answer again. So I worked with Amy for a long time, very dedicated public health nurse. She would not want this attention at all, and I'm sure she's at home not liking it. But she worked in our school health nursing program for a long time, and then a long time in our epidemiology area. So her expertise was greatly appreciated during this pandemic time. Lastly, I would just like to acknowledge my alma mater, which is Kent State University. I watched last night the pinning ceremony for the graduating class of nurses from the College of Nursing. I'm a proud member of 13,000 nurses from the school. And we normally have an in-person pinning ceremony, which is a rite of passage for nurses. And it used to be a capping ceremony, if people remember that. So they did that virtually, and all of us alumni were able to share in that. So they're entering nursing at a very interesting time, but they are equipped with the knowledge that they've gained through their schooling. And just lastly, flashes, take care of flashes, and we'll get through this. So I did want to point out that, we want to make sure that people are still seeking emergency care when they need emergency care. So we've seen a decrease in the trend in the number of emergency department visits in our county since this pandemic has began. So Cuyahoga County normally averages about 1,200 to 1,400 ED visits a day. And after the stay-at-home order went into effect, we saw a pretty significant decrease in that trend. And at the beginning
thank my brother-in-law, Brendan Walton, who owns a place called Cleveland Coffee Company. He's donating some food to us. He runs the St. Baldrick's Foundation, which does childhood cancer research, and people shave their heads to raise money for cancer. And so he's the local originator here, and so he's got a big heart, and he's donating some food for our staff today, so I wanted to thank him. So with that, we thank you for being here. Continue to be safe. We appreciate the leadership of the media in wearing protective equipment and helping us to enforce those social distancing guidelines and your messaging back to Greater Clevelanders. That's critical as we go forward to maintain this flattening of the curve and to continue to protect the people we care most about. So, thank you.